Welcome to another video on rhinoplasty. Today I will take you all through steps of nose surgery or the so-called rhinoplasty, open rhinoplasty that we propose to do on a 29-year young lady. She has presented to us with concerns that her dorsum of the nose is shallow and the base of the nose is broad, and that she feels that the nose is short. So these are her main concerns. She wants the height to be increased, nose to be narrow both at the top part as well as in the base, and she would desire to have a sharper nose. So this is her main concern. So we plan to do an open rhinoplasty. Our main aim is to harvest good amount of cartilage. So cartilage is the little softer tissue that is present in the nose. The hard part is the bone and the soft part is the, apart from skin, you have inside framework which is made up of what is called cartilage. Now such similar tissue is available also in your ears as well as in the first part of your rib cage. So we call them costal cartilage. So cartilage supply to build the dorsum of the nose can be harvested from either from the ear or from the costal cartilage. So our first preference is the cartilage from the patient's own septum, so that we don't add additional scars. So many of our patients express concerns regarding additional scars, be it ear or in the underbreast area. However, when the height increase that is proposed is very significant, we do need to harvest costal cartilage or the ear cartilage based on the requirement. In this patient, we plan to do open septorhinoplasty. So I will take you all through the steps of the surgery. We do an open septorhinoplasty. We open up the skin and expose the framework. Then we will evaluate the septum, and then we will harvest the cartilage that is possible, maximum cartilage that's possible from the septum. And after we harvest the cartilage, we will reduce the nasal bone width by doing osteotomy. So we will we'll break the nasal bone here and narrow it down. And after we narrow it down, we will start with the plan of increasing the dorsal height. So we will evaluate harvested cartilage is enough, and we can get the desired height with the harvested cartilage. If that is not sufficient, we plan to harvest ear cartilage for this patient, because we've discussed with her and she does not desire an additional scar in the underbreast area, and so she does not prefer costal cartilage. So once we assess the height that could be obtained with the harvested cartilage, then we do the tipplasty or the correction of steps to correct the sharpness of the tip, and then we place the harvested cartilage in such a way to increase the height. And then we also will use some cartilage to lengthen the nose a bit. And once the final result is assessed, we will decide whether the patient will require a base reduction, and most probably, which I think she may not need. So please join me and let's take a look at the steps of the procedure.
First step in open septorhinoplasty is making an incision. So in open septorhinoplasty, we are making an incision in the columella. This incision in the columella is continued with the infracartilaginous incision, which is inside the nostril and which is not seen. Hence, after rhinoplasty, the only scar which is visible will be in the columella underneath the nose. Here we are dissecting the lower lateral and upper lateral cartilages and elevating the nasal skin up to the root of the nose. Here we are trying to access the nasal septal cartilage by dissecting the lower lateral cartilages. So once we dissect the lower lateral cartilages, the nasal septal cartilage will be visible. Final step of the septo-rhinoplasty. Here we are closing all the incisions, and here you can see the suturing of the incision of the columella.